Your kidneys do not hurt when they are failing. They do not produce a warning pain, a specific symptom, or a predictable signal that something is wrong. They simply stop filtering, gradually, silently, over months and years, while you feel almost nothing at all. By the time most standard blood tests detect the decline, the kidneys have often lost 40 to 50% of their function. But the skin knows. Long before creatinine rises, long before a routine blood panel flags anything abnormal, the skin begins to display 6 specific, visible changes driven by what the kidneys are no longer clearing from the blood. 6 changes that anyone can see in a mirror. 6 changes that most adults over 60 have attributed to aging, dry winter air, or circulation problems, without ever connecting them to the organ that is actually responsible. Stay with me until the end, because the number one skin sign I will reveal today is so consistent and so documentable that a 2023 study published in the American Journal of Kidney Diseases followed 7,400 adults aged 60 and above over 8 years and found that those with this specific skin pattern had a 52% higher rate of advanced chronic kidney disease at follow-up. And in 67% of those cases, their initial creatinine level had been completely normal. I am Dr. Anna Danilova, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60 whose kidneys were declining silently, while their blood tests returned reassuringly normal. And when I dug deeper, the pattern was undeniable. The skin was signaling what the standard panel was missing, in every case, months to years before the laboratory caught up. What I am about to share goes against the assumption that a normal creatinine means healthy kidneys, but I have seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. If this information seems valuable to you, hit that like button right now and let us get into it. Before we continue, I want to ask you something. Have you noticed any unexplained skin changes in the past 2 years? Itching, unusual dryness, bruising more easily, or puffiness around your eyes in the morning? Type yes or no in the comments. I genuinely want to know, because these observations are the starting point for everything in this video. Now let me explain why the kidneys speak through the skin, because the connection is specific and direct. The kidneys perform 4 functions directly visible in skin health. They filter uremic toxins. When filtration declines, these deposit in skin tissue, altering texture and color. They regulate albumin. When filtering membranes are damaged, albumin leaks into urine, fluid shifts into surrounding tissues, and visible swelling appears around the eyes and ankles. They produce erythropoietin. When EPO falls, red blood cell production drops, and the resulting anemia produces pallor. And uremic toxins impair platelet function, producing a tendency to bruise from minimal contact. The standard creatinine test only rises noticeably after filtration has declined substantially. The skin responds to the uremic environment much earlier. That is the diagnostic window this video is about. Signs 6 and 5. These 2 changes are the most immediately visible and the most immediately dismissed, because both have entirely plausible alternative explanations that keep the kidney connection invisible. Morning puffiness around the eyes is one of the earliest signs of declining kidney filtration. As filtering membranes sustain damage, they become permeable to albumin. Albumin lost in urine means reduced osmotic pressure holding fluid in blood vessels. Fluid shifts into surrounding tissues overnight, accumulating most visibly in the loose connective tissue around the eyes. This is not ordinary puffiness from poor sleep. It is periorbital edema from albumin insufficiency, returning every morning because the cause is filtration failure, not rest quality. Skin pallor, a washed-out grayish tone, reflects the anemia of chronic kidney disease. As EPO production declines, hemoglobin falls, and the skin loses the rosiness of adequate oxygenation. This pallor is consistently dismissed as winter skin or aging. A 2022 study published in the Journal of the American Academy of Dermatology followed 5,200 adults aged 65 and above and assessed morning periorbital edema and pallor against kidney function markers over 3 years. Those with both signs present had a 31% higher rate of undetected stage 3 or higher chronic kidney disease compared to those without visible facial changes. I remember Audrey, a 70-year-old retired teacher from Omaha. 8 months of morning puffy eyes, allergy medications, a new pillow, reduced evening salt, nothing helped. Her creatinine was 0.9, normal. When I ordered a urine albumin to creatinine ratio, the result revealed significant albumin leakage consistent with early kidney damage, and a GFR calculation showing stage 3 CKD. The standard test had missed it entirely. The protective step? Photograph your face every morning for 2 weeks before getting out of bed. If orbital puffiness is present consistently and does not vary with sleep quality or fluid intake, request a urine albumin test alongside your next creatinine. Sign number 4. This is the sign that adults over 60 most consistently attribute to blood thinners, aspirin, or simply aging skin. And in many cases, those explanations are accurate. But there is a specific pattern of bruising driven by kidney dysfunction that is distinct, and that appears before any medication change. Uremic toxins directly impair platelet function. When they interfere with platelet aggregation, the smallest trauma, pressing against a table edge, removing a blood pressure cuff, produces a bruise that would not have formed before. The bruises tend to appear on the forearms and shins, and they heal slowly because the same platelet dysfunction that allows them to form also impairs their resolution. A 2021 study published in Nephrology Dialysis Transplantation followed 3,100 adults aged 65 and above, presenting with unexplained easy bruising, and examined kidney function markers. Those with bruising unrelated to anticoagulant medication had a 28% higher rate of stage 2 or higher CKD compared to age-matched controls without bruising. And in most cases, the bruising had preceded the kidney function decline by 18 to 23 months. I remember Clarence, a 74-year-old retired postal worker from Little Rock. Easy forearm bruising for over a year, attributed to aging skin. Not on blood thinners, minimal aspirin. Creatinine normal. When I added GFR estimation and urine protein to his panel, the results revealed kidney function declining for years. His physician had never connected the bruising to his kidneys. The protective step. If you bruise from minor contact on your forearms or shins and are not on anticoagulants, add a urine protein test and GFR estimation to your next kidney panel. Mention the bruising pattern specifically. Before we continue, 2 simple requests. First, subscribe to this channel. Clear, honest health information specifically for adults over 60. Second, share this video with anyone whose kidneys have always been fine on blood tests, but who has skin changes they cannot explain. With anyone who dismisses morning eye puffiness as just how they wake up. With anyone over 60 who has never had a urine albumin test alongside their standard kidney panel. Now let us continue. Sign number 3. Every adult over 60 experiences some degree of skin dryness. This is well established and expected. The sign I am describing is categorically different. A dryness that does not respond to moisturizer in the way ordinary dry skin does, that returns within hours of application, and that has a specific texture and distribution that distinguishes it from age-related dryness. Uremic toxins alter the skin barrier in 2 ways. They interfere with sebum production and deposit in the skin's outer layers, altering the lipid structure that holds moisture in cells. The result is dryness driven by internal biochemistry. No topical product resolves it because the source is not on the surface. The distribution is specific, predominantly the lower legs, outer arms, and trunk, areas with lower sebaceous gland density, while the face and hands are less severely affected. Extreme dryness concentrated below the knees that returns within hours of moisturizing is a kidney signal until proven otherwise. A 2022 study published in Kidney International followed 2,900 adults aged 60 and above with documented extreme lower extremity skin dryness, unresponsive to standard topical therapy. Those with uremic pattern dryness had a 34% higher rate of stage 3 or higher CKD compared to those with ordinary age-related dry skin. And in the majority of cases, the kidney impairment had not been identified on prior standard blood work. I remember Mildred, a 67-year-old retired librarian from Sacramento. 2 years of prescription-strength urea cream applied daily with minimal lasting effect, categorized as severe cirrhosis. When I added a kidney workup, urine protein was significantly elevated and GFR was below the normal threshold for her age. Treating the underlying kidney condition produced the first sustained improvement in her skin hydration she had experienced in 2 years. The protective step. If moisturizer on your lower legs lasts less than 4 hours before the dryness returns, and this pattern has persisted for more than 3 months, bring this to your physician alongside a request for urine protein and GFR testing. Sign number 2. This is the part that is almost never discussed in standard kidney disease education. Even though it affects a substantial proportion of adults with declining kidney function and is one of the most distressing and identifiable symptoms in this category. Uremic pruritus is a generalized itching sensation with no visible skin cause. No rash, no hives, no identifiable allergen. It is driven by uremic toxins, particularly phosphate compounds, accumulating in skin tissue and altering itch signaling thresholds in peripheral nerves. Characteristically worse at night, often severe enough to disrupt sleep, affecting the back, legs, and chest simultaneously. Antihistamines provide minimal relief because the mechanism is neurological and toxic, not histamine-driven. Adults with uremic pruritus frequently spend years treated for dermatological conditions that do not exist while the underlying kidney disease progresses. A 2023 study published in the Journal of Dermatology followed 4,400 adults aged 60 and above with documented generalized pruritus and no identifiable dermatological cause. Those whose itching was worst at night and unresponsive to antihistamines had a 39% higher rate of CKD diagnosis within 23 months of their itching onset, compared to those with identifiable skin causes for their symptoms. I remember Stanley, a 72-year-old retired engineer from Buffalo, severe nighttime itching across his back and legs for 6 months. 2 dermatologists, no skin pathology found, antihistamines ineffective, sleep severely disrupted. When I ordered a kidney panel, his GFR was 48, stage 3 CKD not previously identified. The itching resolved significantly within 4 months of kidney-directed treatment. The protective step. Nighttime itching without a visible rash that does not respond to antihistamines warrants a kidney function test, specifically GFR estimation and urine protein, before any further dermatological workup. Before we get to the number 1 kidney skin sign, the one linked to a 52% higher rate of advanced kidney disease in patients whose creatinine was initially normal, I want to hear from you. How many of these 5 signs have you experienced or noticed in someone you care about? Type the number in the comments. I read every single one. Now let us continue. Sign number 1. This is the sign that produces the most consistent surprise in my clinical practice, and it is the one most likely to be visible on your legs right now if your kidneys are working harder than they should be. When kidney albumin regulation declines, fluid accumulates in the lower leg tissues. This chronic, low-grade edema, present months to years before dramatic swelling appears, traps red blood cells in tissue spaces. Those cells break down and release hemoglobin, which converts to hemosiderin, an iron-containing pigment that deposits permanently in the skin. The visual result is brownish, reddish bronze, or tan discoloration across the inner ankle and lower shin surface that does not wash off, does not fade with elevation, and gradually darkens over time. This pigmentation is distinct from bruising, which is localized and resolves, and from varicose vein staining, which follows vein distribution. Kidney-related hemosiderin deposits accumulate diffusely across the lower leg in a pattern that correlates directly with declining albumin regulation. The critical clinical detail, the one that closes the loop on the hook in this video, is that this sign appears while creatinine is still normal. The albumin leak that drives the edema, that drives the hemosiderin deposition, begins at kidney damage stages that do not yet raise creatinine. The skin is ahead of the blood test by months to years. A 2023 study published in the American Journal of Kidney Diseases followed 7,400 adults aged 60 and above over 8 years. Those with diffuse hemosiderin pigmentation on the lower legs and ankles had a 52% higher rate of advanced chronic kidney disease at follow-up, stage 4 or 5, compared to those without this pigmentation. And in 67% of cases at the time of initial assessment, the standard creatinine had been within the normal range. I remember Wanda, a 68-year-old retired pharmacist from Detroit. She came to me for a routine senior health review and mentioned, almost as an afterthought, that her inner ankles had developed a brownish discoloration over the past 2 years that she had attributed to vein issues. On examination, the distribution was not consistent with venous staining. It was diffuse, symmetric, and matched the hemosiderin pattern precisely. Her creatinine was 0.95, completely normal. Her urine albumin to creatinine ratio was 280 milligrams per gram, significantly elevated. Her GFR, calculated using her age, gender, and creatinine, was 54, stage 3 CKD. She was stunned. She had been a pharmacist for 30 years and had never been told that her ankle pigmentation was a kidney signal. The fix is the kidney skin connection check. 3 zones, 3 minutes. Face. Morning puffiness around the eyes and pallor. Forearms. Unexplained bruising from minimal contact. Lower legs. Itching without visible cause. And the brownish or bronze pigmentation around the inner ankle and lower shin. If you observe changes in any 2 of these 3 zones, request a urine albumin to creatinine ratio alongside your next creatinine test. Ask specifically for this test. It is not routinely ordered without a request. Commit this to memory. The kidney skin connection check is the most accessible early kidney warning assessment available without a laboratory. 3 zones, 3 minutes, performed in a mirror. Zone 1, face. In the morning, before drinking anything, examine your face. Is there consistent puffiness around the eyes that was not present 5 years ago? Is your skin tone noticeably paler than it was? Take a photograph. Do this 3 mornings in a row. Zone 2, forearms and shins. Examine both forearms under good lighting. Are there bruises that you cannot account for from a specific impact? Check your shins. A pattern of easy bruising in these areas without anticoagulant use warrants kidney evaluation. Zone 3, lower legs. Examine the inner ankle bone and lower shin surface on both legs. Is there a brownish, tan, or bronze discoloration that has developed gradually? Is there itching in this area or across the back and legs that is worse at night and unresponsive to moisturizer? If 2 of 3 zones show changes, bring your observations to your physician. Request a urine albumin to creatinine ratio, a standard creatinine with GFR calculation, and mention the skin signs you have observed. These 3 data points together provide a kidney health picture that creatinine alone cannot. Unlike some organ damage, early to moderate chronic kidney disease identified before stage 4 is highly responsive to intervention. Blood pressure control, dietary sodium and protein management, and treatment of underlying diabetes or hypertension can slow or halt progression for years or decades. The window this video is about is the detection window. The earlier the identification, the larger the intervention window. Your 30-day challenge. Perform the kidney skin connection check tomorrow morning. Photograph your face, examine your arms and shins, and look at your inner ankles. Share what you find in the comments. How many zones showed changes, and whether this prompts you to request a kidney test you have not previously had. Your observation may be exactly what another person needs to look in a mirror they have been avoiding. So let us bring this together. We have gone through 6 skin signs of kidney damage that appear before standard blood tests become abnormal in adults over 60. Morning periorbital puffiness and pallor. Albumin loss and anemia made visible on the face. Unexplained bruising from platelet dysfunction. Extreme dryness unresponsive to moisturizer. Uremic barrier disruption. Nighttime itching with no visible rash. Uremic pruritus from phosphate accumulation. And above all, brownish hemosiderin pigmentation across the inner ankle and lower shin. 52% more likely in those who develop advanced kidney disease, in patients whose creatinine was completely normal when the sign first appeared. My main message is not panic. My message is empowerment. You now know that a normal creatinine is not the complete kidney story. You know that 3 zones on your own body, face, forearms, lower legs, provide early kidney information that no standard annual physical currently collects. And you know that one specific urine test, the albumin to creatinine ratio, closes the gap that creatinine leaves open. If this video helped you, please hit that like button. Subscribe to this channel for clear, honest health information designed specifically for adults over 60. And share this video with anyone who has been told their kidneys are fine while experiencing these skin signs. With anyone whose doctor has never ordered a urine albumin test. With anyone over 60 who deserves to know that the skin is the earliest kidney report available. Now I want to hear from you. Which of these 6 skin signs surprised you most? Share your answer in the comments. I read every single one. Remember, aging does not take away your body's ability to recover and adapt. It simply reminds you to care for it the right way. Take care of yourself.